Thanks for joining us again, folks. The Cancer Treatment Center at Hazleton show. A very informative show we have for you today. We have two parts. This is part one, and part two will be seen at another time. But I'm going to tell you, what we've been doing is informing you and giving you education, okay? We said at the last show, there's a word that we certainly don't want to hear, and that's, you got cancer, okay? That's the bad news. The good news is what they have available today. And joining me once again is Laura Sitch, who is the site manager here at the Cancer Treatment Center here in Hazleton. And we have a special guest. He was on the show before. It's Dr. John Lamond, who is the medical director at Philadelphia CyberKnife. And we're going to learn about that. So I want to welcome the both of you back on the show, okay? It's your show, Laura, so, you know. Laura, I said the word, we say it all the time. Or we know people that are told you have cancer. Okay, so they're devastated. You know, it's a word we don't want to hear. However, I said the good news is we have the Cancer Treatment Center at Hazleton, and we have Dr. Lamond, the CyberKnife, etc. So, what do you tell these people? Okay, what advice do you give to a person, because you guys have been here 30 years, who is told they have cancer?
Well, you know, when that happens, of course, it's a very anxious time, and it's something that probably they don't understand very much about, and yet they have to make decisions about what treatments they're going to take. So they need to hear these options, and then they may think, should I stay locally to hear these options, or should I travel to maybe a big city or a big academic center? They might want to do that and might not be able to do that, maybe financially or physically not be able to do that. So we're here today, like you say, to educate them and let them know that we've been here for 30 years. We have local resources here. We also have other options and connections to places like Philadelphia CyberKnife.
So, and see, that's always the case, okay? Everybody wants the finest doctor, the finest treatment, and you're always here, if you're in a small town, we'll get to the big cities, okay? And that's okay. But the point is, now that we've come so far here in northeastern Pennsylvania, particularly, I said, you're here for 30 years, okay? So there's many survivors that you've had, okay? How do we get rid of that stigma, you know? Because here, you have a lot of treatments here in Hazleton, okay? And wait till we start talking about with John about what he has, and like it's amazing. So what do you have available here in Hazleton, okay, as far as treatment is concerned?
Sure. Well, locally in Hazleton, as we discussed before, we have what we call external beam therapy, radiation therapy. And so we treat many diseases such as lung cancer, breast cancer, prostate cancer, maybe cancers of the head and neck area. Just to name a few. Mm-hmm.
So what would be the process then? So they call you, or they come up here, who do they talk to, who do they meet, you know, what do they do? What would be the process?
Well, once they're diagnosed, they generally will get referred to the radiation oncologist, such as Dr. Lamond or our local doctor, Dr. Steve Karp, or maybe even Dr. Arrigo. And he will review their information, maybe discuss some of this information with some other specialists. And if it's decided that they need radiation therapy, well, then he'll have to decide what type of radiation therapy is the best option for them.
So we talk about technology, okay, and the first show we did, we showed, you know, what you have available, the CT scanners. What about your technology? Is it up to modern, you know, standards, or, you know, because here again, people think it's a small town. Okay, of course, it's not that small anymore, okay, with the medical advances we have is fantastic, okay. So what do you have to offer them?
Well, what we have is, as we mentioned before, in 2012 we moved into our new location, and at that time we brought in a CT scanner on site so that we can do our scanning right there, which is what we need to do our treatment planning. And we also brought in what we call onboard imaging. And that allows us to localize the tumor, stay localized and targeted on it while we do treatment. So those two advances are really nice for
Okay,
our
so
center.
just to review for our viewing audience, God forbid you hear that word, you know, you got cancer, okay, and you got the shock, and then of course you're talking to people, and either relative says, when my sister had cancer, we did this, we did that, and that's, I mean, that's common, okay? Mm-hmm. What do you do? Where you go? So once the shock goes away, and we call the Cancer Treatment Center here, and the phone number is on the screen as well as the website. you know, you give them a information as to what you can do for them, okay? The question I would ask is, well, have you done this before? Okay, have you had people who had this type of cancer, etc.? Okay, so what do you tell them?
Well, you tell them what you know at that time. So if you've had, you know, if they ask that question and it's what we've done before and we think we can treat it, absolutely. If it's something that we think may be better treated somewhere else, then they'll get referred out.
Yeah,
to someone else.
The success rate has been, thank God, pretty good. That leads me to the good Dr. Lamond. Doctor, nice to see you again.
Good to see you, Sam.
Okay. You're the medical director here at Philadelphia CyberKnife, okay? Is that correct?
Yes.
All right. Now, the second show, we're going to get a little more detail, but I would like for you to just give me a general description as to why do you use radiation therapy to treat cancer?
Right. Well, you know, we have really 3 different types of treatments for cancer in general. Surgery, you know, but there are many times when you can't do surgery because it's located too close to some vital structures that can't be removed. And radiation therapy is really the most effective means of treating those types of patients, commonly with some systemic therapy at the same time. Even if you can do surgery, many times radiation therapy is used locally to help mop up after the surgery to decrease the risk of the cancer growing back.
When you're looking at a person who has cancer, there are some tests that you do that you're able to tell whether it's first, second, third, or fourth stages, correct?
Right.
All right.
Right.
So now, when does the doctor determine this has a 50-50 chance, this has a 60-40 chance, this is like 80%, you know, bad, or how do you know that?
Right. Well, you get the stage.
Yeah.
And what many people don't know is whether you're in Hazleton or New York City, we have national guidelines about treatment. And so these national guidelines are on the website through the NCCN. And so stage for stage, we have recommendations about what treatment is best. And they do mention many times what the prognosis is when you do that type of treatment. And so that should be reassuring to a lot of people in Hazleton that whatever the doctors are doing at Hazleton is very consistent with the doctors in other big cities. Also, Dr. Karp up in Hazleton is working with Dr. Arrigo down at our practice here at Philadelphia CyberKnife, reviewing cases on a weekly basis. So every case that is treated is being reviewed by at least 2 different doctors, 2 different radiation oncologists to get opinions. And many times they'll call me and ask me a question about a case, whether it's a potential candidate for CyberKnife treatment. Mm-hmm. So CyberKnife's a very specific type of radiation therapy that we can do. It's not done everywhere. When we got our machine 12 years ago, Sam, it was only the 25th machine in the world. So over those 12 years, we've gained a lot of experience, but we don't want to have patients come here from Hazleton unnecessarily.
You said something, there's a national guideline, all right?
Right.
And the idea is, once again, you know, that what we have available in Hazleton or what you have available in Pottstown or Philadelphia, et cetera, you're still working in that same guideline, correct?
Absolutely.
Okay. What have you, stupid question, but for our audience, what have you seen throughout your career in the therapy and what you could do for cancer?
Right. I mean, it's been amazing. It continues to amaze me, the differences, the changes overall. When I started in my residency, it was just very early on where we were seeing benefits of combining chemotherapy and radiation therapy. But one of the problems was we saw the benefits, but we also saw increased side effects. So we've learned a few tricks about how to deliver the radiation therapy, called intensity modulated radiation therapy. And all of this is available at Hazleton. So it's a way of fine-tuning the external radiation to the areas where you want to try to minimize the side effects. Even more refined is a process called radiosurgery. That's what we do with the CyberKnife. So all these things have occurred over a relatively short period of time. 22 years ago, we didn't have a CyberKnife. It wasn't invented. Now we use it to treat all different types of areas of the body. We can cure patients with inoperable lung cancer. It's just been exciting, the list of developments. I'm not even talking about all the developments in medical oncology, where now they have not only chemotherapy, they have targeted agents, which are generally pills, and they also have immunotherapies as well. So it's a very exciting time in cancer medicine.
And part 2 of the show, we're going to get a little more specific in those areas.
Right.
When I heard them saying CyberKnife, I'm thinking this big knife.
Most people do.
Yeah, I think it's a big knife. They're going to cut me up, and
It was a bad name. I must admit, but that's what they called it.
Yeah.
And
what is a CyberKnife?
So the CyberKnife is simply a robot that delivers the radiation therapy, very focused radiation therapy. And so most of the machine is literally the robot that also it's a KUKA robot. It makes all kinds of things, including cars. You've seen it in commercials. It's very functional. It's been around. So somebody married that with the radiation unit, and now we have ways to treat even a nerve as thin as my hair with the machine very accurately. So it's a very accurate machine, but it also can treat a moving target, which is very unique with it. So as you breathe, tumors, cancers in the body move. And so this is the only machine that really deals with that movement, because the machine can move with the breathing.
So as you're saying, there's different areas that the machine can help you with. Okay, now, as you working this machine, is there a certain amount of I'm saying a prescription? Okay, I'm saying, are you prescribing 10%, 20%? I don't know of the radiation. How do you know how much radiation should go into this one specific area? Or is it the same for everything?
No, it's not. So, it depends. Thankfully, here at Philadelphia CyberKnife, we've treated over 3,000 patients, so that's helped us. We've always been on the cutting edge, so people call us with that sort of question.
Yeah.
But it really depends on the scenario, how much we deliver. But our goal usually is to kill off the cancer, not just to shrink it, to kill it off. And we may only use 1 to up to 5 treatments with the CyberKnife. So it's a very few number of treatments, very focused radiation. It's not for everything, but it can be useful for a lot of different cancers throughout the body.
Folks, on part 2 of the show, we're going to get more specific with Dr. Lamond as to the CyberKnife and all the great things that are available. So, Laura, just getting for a review here. At the Cancer Treatment Center at Hazleton, okay? Once again, what do you have to offer for those people, unfortunately, who are told they have cancer? Just a brief synopsis again.
Sure. Well, locally we offer external beam radiation therapy, including intensity modulated radiation therapy, or the IMRT that we spoke about in the previous segment. That's available in Hazleton. Brachytherapy is also available in Hazleton for prostate cancer cases. And then, of course, we have this extension into Philly with discussing other options.
So there's all these opportunities that we have available to us, all right? And you don't necessarily have to go to the big city, okay, unless you're going to CyberKnife. Now, I know we came down here today, and I was here in less than 2 hours, all open road, etc. I hope I never have to come down to have the CyberKnife. If I did, I would want this guy to make sure that he's taking care of me. But, you never know in life. I mean, things happen, and it just, I'm sure you're not immune to it. You're not immune to it. Thank God we have the cancer treatment plant, and we have people like you that are available to us. But on the next show, folks, on the Cancer Treatment Center at Hazleton show, we're going to talk to Dr. Lamond in detail, finding about different stages and what we're doing. It's education, it's education. Websites up there, Laura's team's available, Dr. Lamond's team's available, just to give you an education. Phone numbers on screen. Thank you, Doctor, for joining us segment 1. You'll be back.
Sam.
And Laura, it's always nice seeing you. We'll see you next time.